And it's up.
Good morning, everyone, or good afternoon. How could I think it's morning? I've been here this many hours. But thank you for joining us. I'm Nicole Mack, the principal at Conservatory Lab. And we have a number of people who have joined us here today so that we can all learn a bit more about the COVID-19 vaccine now that it's available for our children. A lot of us as adults are vaccinated, and I think some of us felt comfortable as adults, but we really want to make sure we fully understand more about the vaccines as our children are getting vaccinated. And so we've partnered with Uphams Corner Health Center to help us with those endeavors. So we have a panel of people here to talk more about the vaccine, a little bit about how they're developed and the process, and specifically around the COVID-19 vaccine, and then also to learn about the vaccine clinic that we'll be hosting at the school along with Uphams Corner Health Center. So we can start here.
Great. Hi, everyone. My name is Dr. Niccoloro. I'm a clinical assistant professor and the medical laboratory science program director at UMass Lowell. My focus is in clinical microbiology and public health education, and I will spend a few minutes speaking with you all a little bit about the coronavirus structure and the and a little bit more background on the coronavirus before our physician will follow up with some details on the vaccine itself.
Hi, my name is Nurse Brown. I'm the school nurse at the upper school, and I will be working with the vaccination team as well as just being a familiar face with students.
Hi, I'm Greg Groover. I'm president of the board here at the Conservatory Lab Charter School. I'm representing the board members, and we are deeply concerned and deeply supportive of the efforts toward making sure that our school is a very safe school, as we believe it is. And we want to do everything as a board to support those efforts. So we're glad to be a part of this town hall tonight.
Good evening. I'm John Castellini, the Chief Operating Officer for the Conservatory Lab Charter School. And I just want to thank you for participating tonight in this panel as part of our multi-layered safety protocols to keep our school community safe.
And Dr. Geltman.
Hi, good evening, everybody. I'm Paul Geltman. I'm a pediatrician. I've been a physician for about 30 years, and I am the Chief Medical Officer at the Uphams Corner Health Center right next door to the charter school. And very excited to be with you this evening to talk with you and share some thoughts about COVID and the vaccine.
Thank you. All right. So I think first we wanted to talk a little bit about just how vaccines are made, how they work. So I think here's our general agenda today. As I talked about, learning a bit more about COVID-19, vaccines and how they work, and more specifically about the COVID vaccine. All right. Okay. Mr. Ryan. Oh my goodness. Let's see. Okay, nope, forget it. I figured out what happened. Okay, so were you going to start talking a little bit about the coronavirus?
I'll start off a little bit about some background information. This might be redundant because I think we've been hearing a lot about this for the past 2 years now, but I'll just go through a bit of background on coronaviruses, in specific SARS-CoV-2, the causative agent of COVID-19. So coronaviruses are one of many groups of viruses that are known to cause the common cold. They actually account for upwards of 25% of our annual colds. Until recently, coronaviruses really caused a relatively mild disease. But recently, since 2009, I'd say, we've seen the emergence of 3 strains capable of causing much more severe disease. in humans. Coronaviruses get their name from their physical structure. When we look at them under a very, very strong microscope, they appear to have this kind of crown or halo-like appearance, and that's where it gets its name. Corona means crown in Latin. So you can see the image on the right side of the slide here. This is a scanning electron micrograph of 4 coronaviruses, and you can see those tiny little projections around the spherical-like structure. Those are the spike proteins, which I believe Dr. Gilman will talk a little bit more detail about. And that's where coronaviruses get their name. So just quickly, a little bit about the structure of your coronaviruses, specifically SARS-CoV-2. So again, SARS-CoV-2 is the causative agent of COVID-19 disease. The structure of the virus, it's an RNA virus. That the RNA is the genetic material that's housed and provides kind of the blueprint or the directions for that virus's structure and for how it should replicate. The virus genetic material, that RNA genetic material, is surrounded by a protein coat. That protein coat really is serving a protective-like function for that genetic material. And then our coronaviruses have a secondary coating referred to as an envelope. The envelope is lipid or fatty in nature. And we'll see the lipid envelope studied with many proteins, and one of the most important proteins is the S protein spike, which is shown by those red little projections on the surface of that coronavirus we have on the right side of the slide here. The S protein spike is really important in allowing the virus to locate and bind to host cells. Coronaviruses and COVID-19 are spread via contact with infected person's secretions, specifically respiratory secretions, so coughing, sneezing, droplets, and aerosols. It's spread via close contact, such as caring for or living or being in close proximity to those individuals that are infected. And one of the most complicated components to this virus and this disease is that individuals that are infected with the coronavirus may not exhibit symptoms, but they can still spread the disease. So that's something why the vaccine is actually so very, very important. I think many of you have been hearing a lot about variants on the news recently. So just quickly what a variant is and how they occur. Viruses, specifically RNA viruses like your coronaviruses, constantly undergo mutations. These are subtle changes to their genetic material that can, thank you. These are subtle changes in their genetic material that can ultimately create changes in their structure. These subtle changes can potentially make the virus more successful at infecting individuals and spreading more efficiently. For that reason, we are constantly tracking and surveying the various the various coronaviruses in the population and looking to identify these strains and the differences between these strains. And this is really, really important because, and I have a list right here, the variants potentially could allow the virus to spread more quickly between people in the population. They may have the ability to cause a milder or more severe disease in a population. It may result in the ability for the virus to evade detection by some of the diagnostic tests that we rely on to identify whether or not a person has coronavirus disease. It also potentially could result in decreased susceptibility to some of our medical therapies that we are employing, such as, for example, monoclonal antibodies. And also the ability to evade natural or vaccine-induced immunity. So these variants can be quite significant. The way we get variants is allowing the virus to spread rapidly through a population. And I was giving the example earlier. You can think of the way these variants evolve, like the game telephone we used to play when we were kids. So if you remember, as we share the message from person to person, it changes slightly as it moves through each individual. That's essentially what the coronavirus and many of our viruses do. As they move from person to person, we'll see these subtle changes, and these subtle changes can add up significantly over time and create these new variants that can be potentially dangerous. So just quickly here, some of our COVID-19 symptoms. There's a very, very wide range from asymptomatic to mild to very, very severe. Our symptoms typically appear anywhere from 2 to 14 days after initial exposure to the virus. And here's just a nice chart showing you the most common symptoms seen in individuals with SARS-CoV-2 infection. So fever, cough, fatigue, headache, sore throat, nasal congestion, chills, shortness of breath, muscle and body aches, loss of taste and smell, conjunctivitis, and potentially vomiting and diarrhea.
Dr. Gelman or Nurse Brown, what have you been seeing from some of the patients that you've been seeing that have been infected?
So for the students, mainly here, a lot of them are actually asymptomatic. We don't really know until we test them. But aside from that, it's probably 2 symptoms at most for most of the students. So a lot of times I don't see a fever. It's usually like a mild cough. They might say they have a little headache. Or a student will say, oh, I couldn't taste my food this morning, or I have nasal congestion. But it's usually not like spread across the board. It's not all of the symptoms at one time. And most of the time, if they do show symptoms, it's usually 1 or 2. So it's pretty hard to tell if we weren't testing on a weekly basis.
Yeah, I mean, in younger kids, it's usually going to be a pretty mild disease, but that's not necessarily the case. And the problem is, even if it's mild for that child, and the way you're describing is exactly what we see typically in younger kids, some mild cold symptoms, not necessarily even a fever, but just, you know, stuff that looks like a cold, little maybe runny nose, a cough, not usually the classic full symptoms that you might see in adults that are described in this slide. And but the problem with kids is that they still can get very sick. There's a particular syndrome called multisystem inflammatory disease that children get, which can be very disabling and cause long-term permanent consequences. And children can also die from COVID. Now, that happens much less frequently than with adults, particularly older adults, but it definitely happens. And it's not in the news so much because it's not as common, but I hear about the kids who are in the ICUs at the different hospitals around town. But it doesn't make it into the news because the vast majority of kids have mild illness. But the problem is they can spread it to other people, like older adults who might be susceptible, family members, infants. So it's a real problem. Sometimes kids don't even have any symptoms, as can be the case for anybody. So when I'm going to pick up with the slides here, we'll talk about the vaccine a little bit. And I just want to give credit where credit's due. Some of these slides I adapted from a former colleague of mine who works over at Cambridge Health Alliance, who had put them together last winter as a part of an introduction to the vaccine for healthcare personnel when they were the first cohort of people getting vaccinated. And I adapted it to use at Uphams Corner and then submitted them tonight. So this first one's about the basics of how vaccines work. It's basically a tool that stimulates the body's own immune system to fight off a disease. And there are different ways they can be administered. Most commonly is through an injection, but also can be an oral vaccine by mouth, or more recently, we've had some that are nasal sprays, like for influenza, the flu. And essentially, they boost our own body's protective response to viruses and bacteria. And this is done by either sort of the old-fashioned way of actually exposing the body to dead versions of those microbes, or parts of dead versions of those microbes, or we manufacture in a lab molecules that look like parts of the microbe, or more recently, genetic material that encodes to produce a part of the microbe within our body. And I'm going to explain that as we go along, because that's what we're talking about with the vaccines we're using with kids. So if we could go on to the next slide. So each year in the US, we know from historic norms that around 3 million children's lives are saved due to vaccination. And that's pretty significant. Things like whooping cough, measles, tetanus, we rarely see them nowadays, although with measles, you've heard, occasionally we've had some outbreaks in this country because of dropping vaccination rates in some areas of the country. If we could go to the next slide. I'm old enough that I, have a parent who had polio as a college-aged student. I think my dad was 19 when he contracted polio, and I know what it's like. But a lot of people in the U.S. have grown up in the era of vaccination, and they don't know people who've been affected by these vaccines, by these diseases for which we now vaccinate kids. But they're deadly, and coronavirus is no exception. So this slide shows you the pathways of how the 3 different types of vaccines that are out there work. The one specifically we're focusing on is the 3rd pathway at the bottom, which is what's referred to as the mRNA vaccine. And so in a lab, it's this mRNA material, and I'll explain what that is in a moment, is manufactured, and that teaches our body's normal metabolic systems how to produce this spike protein that you heard about. And that protein then is produced by the body in the area where the vaccine was injected. Our immune system recognizes that as a foreign protein and develops the immune response to fight it off in the future. So if we could continue with this next slide. So this is again about the spike protein. So it's a great target because of its abundance on the surface of the coronavirus. And that's important to have a viable target for a vaccine. Vaccines stimulate our body to produce antibodies, and these antibodies have to have a target that they're fighting. And so when you talk about using genetic material, mRNA, to teach our cells how to produce this protein, a lot of people get nervous. Is that like turning our cells into viruses themselves? And that's not how this works, because you need the whole virus's genome or gene pool to make a whole new virus, whereas you're just using a tiny little snippet of RNA, which is an instructional protein that teaches our body's protein manufacturing system just how to make that protein, and that's it. So if we could go to the next slide. So think of it like a house with a flag on the front, and you're telling someone how to find that house, and you say, look for the house with the big flag out front. Well, that's what these spike proteins serve to do for our immune system. They identify the virus as being different from our cells, which don't have those spike proteins on them. If we could continue. So a little bit about mRNA. It's short for messenger RNA. They're strands of genetic code material that are used to make protein inside our body cells. And all the proteins inside our bodies are manufactured by producing and then reading and decoding mRNA instructions. So essentially, this is a natural part of how the human body or any animal's body works. We produce proteins, which are the building blocks of our entire existence, through genetic instructions called mRNA. All right, so some scientists decades ago had the idea that if we could teach the body to use a certain type of mRNA, it could produce key proteins for treating or fighting any number of different types of diseases. So this technology has been in development for decades. And that's an important point to consider when people think about these vaccines as being experimental. They're really not. They're at an adaptation of at least 2 decades of research that have gone well beyond the experimental to the practical applications. So it exploits our body's own natural protein building process, these mRNA vaccines. And as I explained it, the vaccine delivers the mRNA into the body, encoded to produce this spike protein. The body then reads this code, produces the spike protein, and then once we are producing what's called an antigen, the spike protein, the body recognizes it as not being part of itself and develops an immune response, protective antibodies to fight against it. Next slide. So the Pfizer and the Moderna vaccine use mRNA, and in kids right now, the only vaccine approved for under 18 is the Pfizer vaccine. So in terms of how it works, it's graphically depicted here, but these 2 vaccine products put the mRNA inside a little ball of lipid, and it's microscopic. But if you think of, like a drop of water, that's basically what we're talking about. But instead of water, it's a little, like a little balloon of fat with some of this RNA inside it. That's then injected into your arm, right? And the cells around that injection site in our body, the fat just sort of, the lipid capsule just melts into the surface of our cells and releases the mRNA into our cells, where it's then picked up by the cell's protein manufacturing machinery to produce that spike protein. And then the protein, as all proteins do, protrudes out through the membrane of the cells and becomes a target for our body's immune system, which recognizes it as being a foreign protein. So if we could continue on. The other question that some people have is like, is this turning my cells into like a version of the virus producing this spike protein for the rest of my life? And what are the consequences of that? I had that very question myself about a year or 15 months ago, and then I did some research on it to educate myself. That's not how mRNA works, and it's not how these vaccines work. mRNA is a very unstable molecule, which is part of the challenge in using it for a vaccine, is it's very fragile. I think everybody's heard about how the Pfizer vaccine has to be kept in deep freeze and handled very gently. So it's a very unstable vaccine in terms of its handling. But that also means the mRNA degrades very quickly inside your body. It doesn't stay there long term. It just basically is, think of it like you flick the switch on and then right off. So you get this little burst of these spike proteins being produced, and then it's done and it goes away. Those cells that produced them eventually just turn over and die, as all the cells in our bodies do, and they go away, and that's the end of it. So safety is a huge advantage of this type of an approach. There's no live viral particles involved. It's safely and synthetically manufactured in a lab. It does not enter into our cell's nucleus or our normal cell genetic material. And they've been shown to be safe in studies in humans for different purposes, going back at least 13 years. But as I said, the actual development of this technology using mRNA goes back at least 2 decades. And it was mainly thought to be a technique that could be used to produce vaccines against cancer proteins. But while they've been shown to be very safe for treatment of cancer, they haven't been shown to be effective enough to warrant approval by the FDA. But the safety track record was clearly established. Now, in terms of these mRNA vaccines, both Pfizer and Moderna have been shown to be extremely effective and safe I didn't update this, but it was, when I put this together, we were just talking about for Pfizer, people 16 years of age and older. Since then, of course, we've had more recent data, first with younger adolescents and now with school-age kids, that the Pfizer vaccine also is very, very safe. I looked at some data on how many doses of vaccine have been given out in the US and worldwide. In the US to date, we've given out, I can put it up here in front of me and I'll give you the exact numbers, but worldwide, just among the top 10 vaccinating countries, around 5 billion, with a B, 5 billion doses of these vaccines, not just these two, but the other COVID vaccines as well, have been given out around the world. And in the US, it's, I think it's about 350 million have been vaccinated. So these vaccines are not experimental anymore. Anything that could or might possibly happen with these vaccines is well known and documented at this point. There's a tremendous safety record with them. And the one thing I will say is that we also have to keep the perspective that the vaccines were developed and tested to prevent severe disease, hospitalization, and death. We've all heard that there are breakthrough infections. There's no denying that. But people with breakthrough infections who are vaccinated are extremely unlikely to spread that infection to someone else. And they're extremely unlikely to end up in the hospital or die from the disease. The vast majority of people you hear about getting hospitalized and dying from COVID in Massachusetts and elsewhere in the country are people who have not been vaccinated. So let's go to the next slide. And by the way, that includes kids, since we're talking about kids. So just quickly, how it was developed. Another question people had was, how could it have been possible to safely develop a vaccine so fast? Well, as I said, at this point, 5 billion doses or more of these vaccines have been used around the world. So questions about safety and track record and the effectiveness of the vaccine are really settled at this point. There's no questions about them. But the reason is because there was a ton of previous research. We heard about the prior versions of coronaviruses that were similar going back 15 years. So there's a lot of existing research about coronaviruses. We've developed substantially faster ways for manufacturing vaccines. And you also have to remember the huge amount of money that went into funding these, which allowed simultaneous studies being done on multiple vaccines across multiple sites in multiple countries. That all greatly compressed the time frame in which the research could happen. And then, admittedly, the FDA regulators knew they had to act quickly, so they expedited the process, and rightly so, given the state of emergency. If we could go to the next slide. The other thing is, very quickly, when the vaccine emerged in China, researchers there described the entire genetic sequence of the virus and transmitted it around the world. So right from the get-go, that was available to everybody. So is the vaccine safe for kids? It's pretty clear. There have been clinical trials. In fact, I think some people like myself were getting pretty impatient that they were trying to get as many kids in the research studies as they could, and seemed to me like they were delaying rolling it out for kids as a result. But we have really solid research data showing that the vaccine is safe and effective in kids as it is in adults. There were no serious safety concerns identified. Side effects, when they do happen, are typically mild. They don't last long, usually no more than a day or two, and are similar to any of those experienced with other routine vaccines that most kids get. So is it safe for kids with allergies? Yeah, it is, to be honest with you. Just having allergies is not a reason a child should not be vaccinated. The only really true reasons not to get this vaccine is if you have an allergy to any of the ingredients of the vaccine. And the main one is polyethylene glycol. And this text comes from the CDC, but I added, just to make sure you know what that is, that's the active ingredient of the stool softener or laxative Miralax, which is available over the counter and is used by tens of millions or hundreds of millions of people. It's extremely safe. But if you know that you're allergic to polyethylene glycol, then you should not get the Pfizer or Moderna vaccine. There are some other ingredients as well, but this is the main one that people suspect is the issue. Other than that, people who have other types of allergies, one of our doctors at the health center has a history of severe allergies, had a severe allergic reaction to a different vaccine. She got COVID vaccine and did just fine. So we will watch people who have a history of severe allergies for a little longer after they get the vaccine. But other than that, people with routine routine allergies do just fine.
What about people with asthma? A parent is asking that. I know I have pretty severe asthma.
That's a great question. I've heard this question before where parents say, my child has asthma, is it safe for them to get the vaccine? Thinking that it might, because it's coronavirus, it might give them some kind of adverse reaction. And it's actually the exact opposite. People, including children who have asthma, are at very high risk for severe COVID disease or death and absolutely should get vaccinated. They were among the first people we were trying to get vaccinated after healthcare workers and first responders. So just having asthma, if anything, is a reason you should get vaccinated. And it certainly is not a reason not to get vaccinated. So,
what about children with diabetes? That's another fairly.
Yeah, same thing. People with chronic diseases, no matter what their age, are at substantially higher risk of severe disease, hospitalization, death, and long-term adverse consequences from the coronavirus, COVID-19 disease. They should absolutely get vaccinated. And I'll say it again, the only reason not to get this vaccine is if you have a history of a severe allergic reaction to the ingredients of the vaccine, mainly polyethylene glycol, and you've had a severe allergic reaction to a dose of the vaccine already. Those really are the only two reasons not to get vaccinated. If you have a child who has a disability, a respiratory disease, a chronic disease like diabetes, absolutely get them vaccinated. They should be at the front of the line.
So we're glad that we're hearing you say this with such emphasis, because parents and the general population, we don't hear this as specifically as you're stressing right now. And I think it's important that the parents hear that what you're saying and what you're urging from your medical perspective is that shy of those specific allergies, there should be no other reasons, physical or medical reasons, for children to not be vaccinated.
Yeah, I'll say it again. The only specific medical contraindication against vaccination is an allergy to the vaccine itself or one of its ingredients. That's it. And it's very clear that this disease can be devastating for people with chronic health conditions, smokers, obese people, including kids. And another big category is people with mental illness or developmental delays. And the thinking there is that they're more likely to be exposed, they're not as able to take care of themselves, and they have worse outcomes with the disease. So if you have a child who has a disability, a chronic disease, a heart problem, a respiratory problem like asthma, chronic diseases like diabetes, certainly things like sickle cell, if you talk about the Black community, they should be the first in lines to be getting vaccinated. There's no question about it.
No.
Doctor, there's a question from a parent that if their child has already had COVID, do they have to wait a full 90 days before they get vaccinated?
Oh, yeah, that's a good question. And I've heard this one before, and I was scratching my head about it. Where does that 90 days come from? And it was not something, God, I wish I could remember where I found it, but it was not, I'm blanking what it was. It was for a specific circumstance where it was recommended to wait 90 days, but I don't think in general you need to wait that 90 days after having coronavirus. You basically don't want to get it while you're acutely sick. And generally we consider that, 10 days from onset of symptoms or date of a positive test, as long as the person has been free of fever without the use of medications for 24 hours and symptoms are improving. So I think I would have to look and double check where the 90-day thing recommendation came from, but I don't think it's a hard and fast rule about vaccinating. And definitely, even if a child has had COVID illness, they should still get vaccinated because the naturally acquired immunity from the infection itself is not very strong. And the vaccination will substantially boost a person's immunity and afford them much better protection in the long term.
I think that's a popular question around, if you've already had COVID-19 or if you've had a lot of exposure, your family has gotten it, even if you haven't gotten it, is that sufficient exposure that you shouldn't get the vaccine?
Yeah, definitely it's definitely something that comes up a lot. Oh, I already had COVID, I should be immune. And it's not good enough. It's one of those viruses that you can get more than once. The body doesn't naturally produce a really robust immune response. And that's why it takes a vaccine to really provoke it, and having booster, more than one dose. So it's important for people to be vaccinated, even if they've already had the disease.
Doctor, could you just touch on how many doses a child will need and what's the timeline between those 2 doses or 3 doses? Yeah.
The Pfizer vaccine is no different for kids in terms of the primary vaccine series, which is 2 doses given ideally 21 days apart. There's a little bit of wiggle room. It generally shouldn't be much earlier than 21 days, but it can be a little later than that if you need to. But we normally try to give 2 doses 21 days apart. There is no recommendation at this point for a 3rd dose for kids in the early adolescent and childhood ranges. So the Pfizer 3rd dose booster recommendation is just for the original vaccine product, which was approved for people 16 and up. The Pfizer vaccine is 16 and up. So for the younger kids, again, to be specific, it's 2 doses, 3 weeks apart. And the dose is 1/3 of the adult dose, if people are wondering that. It's a lower dose commensurate to the smaller body size.
Is that 1/3 the case also for older children, say adolescents?
No, the adolescent product is the same as the adult.
Okay.
Yeah, it's for these pre-adolescent kids, the 5 to 12 cohort or 5 to 11 cohort, that they use the smaller dose.
So why don't we talk a little bit about what the vaccine clinic will look like at Conservatory Lab. So we'll be having 2 vaccine clinics, one at the lower and one at the upper. The dates are here on the screen, and we'll obviously send this information out to families. All families should have received in your blue folder today the permission form. So there's 2 forms. There's a registration form and a consent form. And there's 2 ways that you can have your family participate. One is that you can pre-register. You can just send in your forms to us. We collect them. We pass them off to Uphams Health Center on the 15th or the 17th. Staff from the health clinic will come to our school and vaccinate your child, and you'll pick them up at the end of the day, or we'll send them home on the bus. The second way that you could participate is you can actually just come to the school at 1 o'clock in the afternoon and meet your child at school and accompany them for the vaccine. You know your child best. I know I've had mixed experiences with vaccines over the years. Since my son is in the back of the room, I won't tell you all the details of those, but I choose to usually not be the one to do that anymore. We know that can be tough with little ones. So you can certainly choose to come with your child. If you're coming to do the walk-in, you also don't have to do the paperwork in advance. So I will continue to bug you about doing the paperwork. But if you forget, you didn't get a chance, you're welcome to just come and walk in at that time, and also bring siblings with you at that time. So
even if the siblings are from another school?
Yes. Yeah, our goal here is really in just assisting people in accessing the vaccine. I know how difficult it is in just scheduling as a parent and working and finding time. We've had discussions about how hard it is to sometimes get an appointment. And if you have multiple people in your family, maybe there's one appointment here and one appointment there, and that's a pain in the neck. So, anything we can do to help things be a little bit simpler, we want to. We do have a couple more questions coming in.
Could I just add to what you've said?
Yeah,
that we're going to be sending over Marissa Correa, who is one of our pediatric nurses, and she's, as all pediatric nurses are, of course, she's very gentle and kind and sweet, and your kids will love her. But she's going to be coming over. And I do just want to emphasize the importance of getting the registration and consent form done. We are required by the state to upload all of the doses administered into the state immunization registry. And to do that, we have to have patients registered in our electronic record system. And that's a good thing for you all, because that means the doses will be there. If your kids are not our patients, your pediatricians can look them up online. If you lose your card or something, we will give you your children a vaccine card, but the doses will be recorded in the state registry, so their regular doctors, if they're not health center patients, will be able to access them as well. And of course, because they're pre-adolescent aged kids, we have to have parental or guardian consent. It would be very unfortunate for us to have to turn away a child who shows up because we don't have a consent form. So please make sure to fill out the registration and consent forms for us.
Well, one logistical question that I would have, only because I'm a pastor of a church, and we recently hosted a vaccine clinic last week. We had registration in advance, but we also allowed persons to do walk-in. This is for the booster shot. And it was supposed to be from 10 o'clock until 4 p.m. By 3 p.m., we ran out. And so persons who walked in after 3 p.m., there were no more shots available. So is there a way that we can guarantee for those who are coming after 1 p.m. that even if they're not, that they would still be able to be?
Well, we'll be prioritizing obviously the folks who pre-registered.
Right.
So we'll be in communication in advance of the vaccine clinic. So if you've pre-registered your child, will have their name and the number of vaccines listed there. So whatever that count is. So those will certainly be guaranteed. And then after that,
1 p.m.
after that, you know, we'll kind of work through. I think Dr. Geltman could better tell us about how, you know, how much supply you bring, what that process looks like.
Yeah, I think I can assure you with near 100% confidence that we're not going to run out of vaccine. We have a lot of the Pfizer vaccine on hand. We are right next door. So even if we don't send Marissa over with enough, she can call over and we can bring her more within a matter of minutes. And even, I guess it's the lower school that's on Hancock Street.
Yeah, it's like 4 minutes.
Same thing. It's like, you know, 4 blocks from the health center. So it'll take us like 5 minutes to bring more over, should we not send over enough in advance. Getting the registration forms and consent forms in advance also is a little bit of a way for us to have a head count in terms of how much of the vaccine product to send over. But if we undershoot it, it's not a big deal. We'll be able to send more over. It's pretty simple.
So I know some people had questions about possible side effects from the vaccine. Could you talk a little bit about that?
Yeah. So this material also is from the CDC. And the nice thing about the vaccine actually is that it does cause some side effects. And that's good because it's the normal sign that your body is responding to the vaccine. I'd get a little more worried about someone who doesn't have any side effects from the vaccine, at least for this particular vaccine, because we know those are the indications that the body's definitely responding to it. Now in the box on the right, it lists what some of the common ones are. I think I can pretty much guarantee that in the majority of people who get this vaccine, they're going to get soreness in the upper arm where the shot's given that lasts, 1 to 3 days. Getting redness or swelling, though, is much less frequent, but can still happen. And that can happen with a lot of different types of vaccines. Flu shots, tetanus shots, they are well known to do this as well. For the older adults who might be listening, or people who know older adults who've had the shingles vaccine, that's notorious for causing lots of side effects. Other more generalized side effects, or what people prefer to call it, are reactogenicity effects, meaning your body's reacting to the vaccine. Is some tiredness and fatigue in the next day or two, sometimes a headache or some aches. Unusually might be fever, chills, or nausea. But most people don't have those. Most people who get side effects, it does not include fever and nausea, but it can happen. I've known people at the health center among our staff who had fever in the day after. The good news is they're typically going to occur within 1 day, maybe 2 at the most, of getting the vaccine, and they normally go away within a day or 2. If there are side effects occurring more than 3 or 4 days after getting the vaccine, you might want to touch base with your child's doctor about it. But it's, for the most part, the vaccines will occur within a day or 2, and then they go away within a day or 2. Many people will have no significant side effects or nothing that really bothers them. And severe allergic reactions, which were a concern a year ago when the vaccines first came out, have now been shown with these billions of doses that have been given to be extremely rare. So I would try to put you at ease that that is something that's extremely unlikely to occur. And it's something that can occur with any kind of vaccination or medication. It's nothing particular to the COVID vaccine. So the rest of this slide just talks about that we will have preparations there. Marissa will know what to do should severe reaction occur. We were operating a mass vaccine site at the Strand Theater for a number of months over the summer and had preparations there For those of you who live in the community, you may remember, or maybe you got your vaccine there yourself. Just one word of caution is with that children and adolescents, you should never use aspirin. So for pain or fever from a vaccine, Tylenol is a good first choice. That's acetaminophen is the generic term for the medication, or ibuprofen like Motrin or Advil. Preferably Tylenol though, and cool compresses, ice packs can sometimes help with what is the inflammation that your body's developing at the site of the injection.
We have a few more questions coming in. One question is in regards to once you have been vaccinated, what does the research tell us about transmission to others? How does that affect that?
Yeah, that was a big question for a while, and I can't give you a precise number because there's so many factors that vary into how a person can be infectious. That might even be our microbiologist could answer better than I, but there are a lot of factors that go into it, like how much virus your body produces. So let's just say if you get the vaccine and you're exposed to someone with COVID and actually get infected, what's been shown is that you're very, very unlikely, and that's as precise as I can be, to generate enough virus in your own nose and respiratory tract to spread it effectively to other people. Now, it's not 100%, it can happen, but it's very, very unlikely. The people who are getting these breakthrough infections, as I mentioned earlier, they're typically getting it from exposure to non-vaccinated people. And then the people who are getting the most sick, hospitalized, and dying from the vaccine are generally not people who are having vaccinated people who are having breakthrough infections, but they're people who are not vaccinated. So yes, it's possible that you can get a breakthrough infection. And then if you have a breakthrough infection, yes, it is possible that you could transmit it to someone else, but very, very unlikely, especially when compared to somebody who is not vaccinated.
Another person is asking, does this shot compromise your immune system since you're getting 3 shots now?
That's an easy one because it's a big no. That's not just it's just not how our bodies work. Right from the moment we're born, our bodies are being exposed to foreign substances, foreign proteins, viruses, bacteria, other types of germs. It's how our bodies are designed to work. As we're exposed to these infectious organisms, our immune systems respond to them and develop sort of a multifaceted memory to respond to later exposures to that same infectious organism. Now that's not to dismiss or not to, that's not to dismiss that there are known scenarios where the body's immune system can run amok. We've all heard of autoimmune diseases, but that's never been something that's been associated with getting a vaccine. And, some of this stuff that you hear, some of these concerns is sort of, I don't want to try to put it politely, but it's propaganda that comes with a political agenda that's either anti-government or anti-public health or anti-science, and that's not how vaccines work. It's not going to happen. The reason you give booster doses or multiple doses in what we call a primary series of vaccination is typically for 2 reasons. One is it's capitalizing on the body's normal way of responding, that you introduce the protein antigen to which you want the immune system to respond, and then you challenge the body again to magnify that response so it's more robust. So that's why you'll see these sequences of giving a series of shots like we do for babies routinely. say for the hepatitis B vaccine, which is a wonderful, safe vaccine that we give to people of all ages, including newborns. And that vaccine we give at birth, we give a second dose at 1 to 2 months of age, and then we boost that with a third dose, typically around 6 months of age, right? That's because that sequence has been studied and shown that it gives the most robust and effective immune response. It's not that it causes immune dysfunction or immune compromise. It's allowing the body to work the way it normally would in defending itself. And so that's how these COVID vaccines work. You know, they were developed very quickly. So there wasn't a lot of tinkering and playing with what might be the best sequence of dosing. And I'll use the Johnson & Johnson vaccine as an example. It was thought that a single dose would be sufficient. And well, it turned out that the Johnson & Johnson vaccine is not as effective as the 2-dose mRNA vaccines. But when you give it a booster dose, it becomes much more effective. So now the Johnson & Johnson recommendation is for a 2-dose series, just like Moderna and Pfizer started out as. And so the other reason we sometimes give multiple doses is because sometimes people might not respond to just 1 dose of a vaccine. And the classic examples of this are some of the other viral vaccines, like the measles vaccine. The measles vaccine is generally effective in something like 95% of people who get it, but there's that small percent of people who don't respond to a single dose. So we give a second dose to make sure that everybody has responded to the vaccine who are going to develop a good immune response. So those are the 2 reasons that you give multiple doses. One is to maximize the body's immune response, and the other reason is sometimes to capture people who didn't respond to an initial dose. I don't think that latter issue is at all at play with the COVID vaccine. I think it's more just about developing an adequate immune response in the body to fight the infection.
Doctor, just one last question from the audience that I think you've already touched on, but it's a common theme we're hearing, that people are concerned that this vaccine was developed very quickly. Can you just touch on the fact, as I heard your initial thing, that it really has been around for a while?
Yeah, that's true. I mean, we had some slides that we opted not to include about the vaccine development process, which normally can stretch over many, many years. But as we all know, for COVID was condensed really to basically about a year. And that's a tremendous scientific achievement that we honestly should be proud of and not worried about, because I think it bodes well for the future that we know that we can safely develop and execute new products like important vaccines in a much more rapid time frame than we historically have done. And, you know, when you think about this virus, we skipped over the slide sort of about the public health impact of the virus and vaccination, but on it, there's a line about what would it be like if we just, we'll go back to it right here. If we just, let everybody develop what's called herd immunity, no vaccine, we just, decided we were going to spend 5 to 10 years developing a vaccine. And in the meantime, whatever happened. Well, we know from this virus that it spreads rapidly. So most of the population would have gotten infected. And maybe about up to 1 in 5, up to 20% of people would have no symptoms. Same thing, up to 20% though would be hospitalized. And we know that up to 3% would die. And if you think about the entire population of the United States, that's up to 9 million people, not 9 people, not 90, not 900, 9 million people would have died in the United States alone in 1 year or 1 or 2 years if we had not developed this vaccine. So I think that it's a little bit of a misguided notion to think that a vaccine product for which now we've given out, as I think I said, the number in the United States is around 350 million doses of these mRNA vaccines, that there's any question about their safety and effectiveness at this point, because there isn't. The rapidity in which they were developed is a monument of scientific achievement, again, that we should be proud of and not worried about at this point. The safety track record is clear. There is really no reason at this point, with the history of vaccination, as well as what we know about these vaccines, to think that there should be any reason to think of there being some kind of hidden long-term health consequence to getting vaccinated. Because again, our bodies are essentially getting naturally vaccinated by organisms every day of our lives. We're being exposed to viruses and bacteria, and our bodies are developing immune responses to them. That's how our bodies work. So I think I would assure you as heartily as I can that the speed in which the vaccines were developed is a good thing, not a bad thing, and saved millions of lives. And I wish more people were vaccinated around the country than are. And I'm just thankful that I live in a state that has one of the highest vaccination rates in the country. And, that we can go about and, at least have some normalcy to our lives. And we want that to include our youngest kids, who have been really, I think, the hardest hit socially by the pandemic, in terms of the impact of 2 years of their lives looking at people with masks on, not being able to socialize with their friends or go out to public events or be at school, right? These are huge, significant, consequential events in the lives of such young children. I worry about that a lot more than I worry about any kind of issue of vaccine safety. And I really wish 100% of your students were vaccinated like tomorrow or yesterday, because it's that important. And to understate how important it is for young kids, you're doing a big disservice to them and your families and your community if you choose not to vaccinate.
We have a couple of questions in the chat here about the myocarditis and pericarditis, adverse effects that have been seen not only with the vaccine, but also with COVID infection. I want to highlight that, but could you elaborate on that associated with vaccine?
That's a good question. So specifically just talking about the vaccine, I mean, the virus itself is this devastating vaccine that can affect multiple body systems and has this weird multi-system inflammatory disorder that is, sort of like this overheated immune response in kids that the virus can provoke that can be devastating. The issue of myocarditis in kids is something that we've also benefited from the rapid development and rollout of the vaccine, because with a slower rollout and slower uptake of the vaccine, it might have taken years for us to identify that this was an issue, but instead it took a matter of months. And actually, I came prepared here. This is, you can't see it, my camera's not focusing on it, but there it is. I'm holding in my hand this week's issue of the New England Journal of Medicine, which has two articles about myocarditis with the Pfizer vaccine coming from Israel, which, if you recall, cut a deal with Pfizer to basically buy enough vaccine for their entire population, and like the entire population of Israel, which is kind of like the size of Massachusetts, is vaccinated. So easy for them to do. a tremendous public health feat for them, but it's also been a great laboratory for studying all of these questions that you've been asking about the vaccine. And basically what they said is that this issue of myocarditis is, I'm reading from it as I talk to you, that it's basically older adolescents and young adults, typically male, so 18 to 29 years old is the highest risk category for it. So it's not something that's likely to affect the very, pre-adolescent kids who are getting the vaccine. And most of it is mild or moderate in severity. Virtually, or very few of the young adults who experience this had any kind of long-term consequences from it. They're saying that in one study, only 10 kids had any evidence of heart dysfunction when they left the hospital. And of these, 5 subsequently had testing. The others didn't have testing, but 5 of those 10 had testing that revealed normal heart function after recovery. So it's something that's clearly an issue for older adolescents, shouldn't be an issue for pre-adolescent kids. And it's something that would become apparent typically after the second dose. And it's something that becomes apparent usually within the first few weeks after getting vaccinated, with symptoms of chest pain typically that, should be evaluated. But it's extremely rare. And to put it in context, the case fatality rate of coronavirus as a whole is 2%. So 2% of people who get infection will die from it. So if you put that in context, that in the entire, let me just go back and I'll give you the actual numbers. In this one study, which was not the nationwide study, but a large health system, it was two cases per 100,000 people of something that was not fatal, whereas people who get the infection, the fatality rate is 2%, meaning 2 per 100. Now, obviously, that includes infirm people like the elderly and people with chronic health conditions. On the younger side, the case fatality rate, as it's called, is much less than 2%. But even if it's 1% or 0.5%, that's substantially higher than 2 per 100,000. So again, the risks of getting COVID as a disease, the infection, are substantially worse than anything like a severe allergic reaction or myocarditis that might come from getting vaccinated. And that's something I really want to emphasize, that we know exactly what the risks, the side effects, things like the severe allergic reactions, myocarditis. There are 1 or 2 other things that affect adults with the vaccine, that these are extremely rare, and they are much rarer than all of the horrible bad things that the virus itself can do to you if you're not vaccinated. So again, get your children vaccinated is the bottom line.
Thank you so much, Doctor.
Thank you. Yeah, I just want to thank you, Dr. Geltman, for joining us this evening. We were really excited when we were able to move both of our school buildings to this location. And, obviously the beginning of this partnership has been different than usual, considering we moved in during the pandemic.
Yeah.
But I can tell you, our staff has been extremely appreciative of your efforts to get our staff vaccinated. Many of our staff people took advantage of being able to run next door to get their shots. That made life a lot easier. And we're really excited to be able to extend that to our students and families over the next coming weeks, and to be able to do some booster shots for our staff as well. Obviously this is a difficult time for everyone. And I think I know all of us have been doing lots of reading and lots of learning. I consider myself lucky that we get, Mr. Castellini and I are able to meet with the public health department on a regular basis and get more updated information, right from infectious disease specialists and doctors. And we recognize that that's not everyone's experience. So being able to have this more intimate conversation with two medical experts in the field and ask all these questions is really helpful because, you know, as educators, we believe, you know, information is power. That's how we advance our thinking. And so all of us have gotten vaccinated in our lives, but I don't know if we've ever thought this much about it or learned so much about the process. So this is really helpful. So we'll be sending more information out to families about the specifics for the dates of the vaccine. And as I said, you should have received your initial paperwork for that you can start sending in whenever you're ready, and we'll send reminders and updates. And obviously, if you have questions about those things as well, feel free to call us. I know that there were some questions about being able to forward some studies about the vaccine and about COVID-19 in general. So I'll follow up with our two experts here to pull together a few resources that we can also forward to families so that you can feel most educated about this situation.
Yeah, I'll just say that, you know, we, when we were first ramping up our vaccination program at the health center last winter, I was doing it myself one day a week to help get it started. And I vaccinated a number of your staff. And, you know, when all of the first people were coming through and getting vaccinated, the healthcare workers, your teachers and staff, you know, I have to say they were like the happiest people that I ever saw going to visit a doctor's office. And it was just such a gratifying, fun time. So I hope it'll feel that way for the kids, although kids never like getting shots. But, you know, it really was a great relief. And I think a lot of your kids are going to feel that sense of relief too, that they have some protection by getting the vaccine, even though it's going to hurt. And our health center website does have some links to reputable online materials. I think we have, links to the early Moderna and Pfizer vaccine studies that were published in the New England Journal, as well as some information from the CDC. But the CDC itself has a ton of really good information for parents and for patients on their website. If you just Google cdc.gov COVID, it'll take you right to it. And we'll work with you to also provide some information and some documents that you can send out as well.
Yeah, so I hope the kids are excited as you said our staff was. I can testify that when it came out time that we could start registering, people were like literally high-fiving when they got an appointment somewhere. So that's funny that it felt that way then when they arrived to your offices.
Oh yeah, definitely. It was a lot of fun.
And I just want to say that on behalf of the board, thank you so much for both of you for devoting your evening for this. We are the huge beneficiary. That is our school being next door to the community health center that you serve as the chief medical officer. And so, and we appreciate your time. We appreciate this, the clinic that's going to take place. We know that our parents, again, will benefit and that we will work very hard to make sure that we have a fully vaccinated staff and student body here at the school. So thank you. You are making a huge difference for us.
That's our pleasure. The health center's been there for 50 years and, you know, it's the largest employer in North Dorchester. So we really feel very committed to the community, and the schools are a major part of the community. And so we're really glad to help out and, you know, hope to do more.
Thank you.
Thank you.
Good evening, everyone.
Everyone.
Good night.
Bye-bye.
Bye-bye.
that had the most. Number was 15.